Hi everyone, I'm Shivani, and this time I'm back with the topic of stem cell therapy, as I promised in the last video. Before I get started, let me make a disclaimer that I'm not a doctor, and this is more like the basic things which a parents need to know about stem cell therapy before if they are considering this as an option. And whatever I'm going to tell you is more like a parent to parent conversation rather than being a doctor telling what uh, the actual therapy is all about. If you have more doubts or anything, you can always go back to the doctor you are consulting with. But in this video, I'll try to uh, tell you everything, whatever as a parent you should know. Okay, so let's get started. First of all, let's understand what is stem cell. So in our body, because see what our body is just like a machine. As a machine needs a repair work and a maintenance work, uh, we are also having that mechanism in our body, and for that purpose, stem cells are present. Stem cells are those kind of cells which can change into any any type of cell. I mean, they can change into nerve cells, cardiac cells, that muscle cells, or blood cells, any cell, wherever the maintenance or the repair work is needed. Depending on that, it will change and take the form of that particular cell. And that stem cell can also change into stem cell itself, but it can take other forms of the other uh, cells as well. So what actually happens is that one stem cell, it will break down into different multiple daughter cells, and these daughter cells, they can develop as any type of cell, any type, like cardiac, blood, muscle, or nerve cell, or as stem cell also. Okay, so this is what stem cell is. And now what what actually where actually this stem cell is present in the body? Basically, when the baby is being born, in the embryo, the placenta, these things are having a lot of the umbilical cord, they are having a lot of stem cell. That is why, like, this umbilical cord, the storage and all that, that are all are happening these days, just to extract the stem cells. So they are having a large number of stem cell. But in adults also, after the baby is born, or in the adults also, the stem cells are present. Basically, they are present throughout the body, but if we talk about the greater number, it's present in the bone marrows. Okay, so what we can do is, because these stem cells are taking the form of any cell, if we are artificially we are transplanting these kind of cells, taking it from the bone marrow and putting it in a particular place in the body, there the repair work, the maintenance will be little faster. Okay, okay, so now next thing is that how does it helps in the autism, ADHD, or in cerebral palsy, or in any other sort of learning disability? So what happens is, definitely in this kind of condition, the brain is not fully developed, or is like overdeveloped, or there is like few or there is like some injury has happened in the brain, there is like some damage to the brain which has happened. Okay, so in that case, if we will see the MRI, we can like make out like which areas, there will be few areas which will not be fully functional or fully developed, or like a repair work will be needed. So what happens in stem cell therapy, that the stem cells from the bone marrow will be extracted, and then they will be directed towards the brain. The procedure will be like, if we go into the procedure, it will be like the doctors will be putting some local anesthesia, and a little bit sedation will be given to the child, and then the stem cell will be extracted from the bone marrow. In the mostly it is done from the hip bone. Okay, and then after extracting the stem cell from the from it, it will be again injected back into the spinal cord of the child. So spinal cord is directly connected to the brain. It will go and leave all the stem cells in the brain, and stem cell have one property that it will automatically go to those areas where the development has not happened properly, or there is some damage or some more functioning has to be made proper. It will go into that area only and form new nerve cells, which that the brain development will start happening. Okay, so this is how it helps in autism, ADHD and all, which is like quite obvious. Like, if you have a wound, and if you can see like how it heals. The skin develops around it and then gradually it dries up, and after a few days you will see like there is no only one mark will be left, and that mark will also go. It happens because our body itself is regenerating the cells. So same thing will happen in the brain as well. Wherever the damage or wherever the development is not there, these stem cells will go and then they will change into new nerve cell, and the brain development, brain maintenance, everything will happen. So generally this is what the procedure is also. It's like very mild anesthesia is also given in the procedure, and this pain and all is it's like more or less painless procedure. And after the therapy also, there is no physical impact on the body. There is no issues, absolutely no issue in walking, sleeping, sitting or anything. Nothing will be there. Only one thing is that we have to take a little care. If the child is young, we have to take a little care that there is like no much impact in the place where the needles have been put for few days, 2-3 days. And we have to keep the child quite hydrated, just to avoid any headache or anything, like how a minor surgery will be there, like that we have to take care of the child. Okay, and if you have any doubts or anything, just do ask your doctor before. Don't remain in any doubt, just ask and have a discussion around that and clear all your doubts before the procedure itself. Okay, now my next thing is like, as a parent, how we should prepare our child if we are going to take the child for the stem cell therapy. Yeah, the doctors will be doing the routine checkup, everything they will make sure, but as a parent, what is our responsibility? So first and the foremost thing is that the child should be healthy. For like before the 3 months, the child should be very healthy. They should not have cough, cold or any other viral infection. They should not have constipation. The gut should be clear. Any such issues they should not be having. They should be eating properly. Everything, like for before 3 months we need to take care of this, because even if it is a very small and painless and simple procedure, but it's like it is a surgery, so we have to take everything into the consideration about the health of the child, and the child has to be very 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 fit before the procedure. Okay, and if the child by chance gets any cold or any constipation or even slightest before the procedure, just take it very seriously. Go to your doctor and take the medication proper, and tell the doctor that you are going for this therapy in this is your this days you are going for the stem cell therapy, and you need to make sure that the child is very healthy or anything. So if they want, by seeing the child, if they want to run some other tests and all, they can run, and then they can know that if any deficiency is there, they can give the medication along with that. So this is like before the 3 months. You have to be like proactive before taking such type of therapies. That is what I mean to say. Next thing is that your pediatrician, the pediatrician who has been seeing the child for since birth, generally we will follow the same. If you are not following the same, if like whatever you are to whoever pediatrician you are taking the child regularly, just go and tell that okay, this is what we are planning for a stem cell therapy in coming 3 months, and we want to know your opinion, and we want to know what all things we need to take care for the child from the general health perspective. So if they will have anything specific about the child, they will let you No. Or if they have noticed anything, they can see the last reports and all. If they have noticed, they can tell you that okay, these things you can use. Or if any supplements they want to give the child, you can use that also. But by supplements, I don't mean that brain wala supplement like we will be giving the fish oil. Ye wo, nahi, no, the body vitamins or any vitamin D deficiencies there, or this thing anything is there. Okay, so if they will be knowing it and they will suggest you. So do follow that as well. Next thing is that same thing, that vitamin D and calcium, which I'm telling you, that is actually very important, because in lot of cases, if there is a vitamin D deficiency or a calcium deficiency, it will be causing a lot of other issues in our children as well, especially in the case of autism and ADHD, where kids are having sensory issues and all. Sometimes they will be like chewing few things or something like that, and it won't be a sensory issue, and it will be just simply a deficiency. So that's why we need to make sure that the vitamin D and calcium deficiency is taken care of. No such deficiencies there in the child. And the next thing is like, before taking the therapy, just make videos of all the activities you are doing with the child. If you are taking occupational therapy, speech therapy, whatever you are doing, just make videos of that. Because after the therapy, again you will have to do the occupational therapy and speech therapy, and whatever you are doing at home, you will have to continue it. So if you want to notice that what has changed after if you want to measure it out, then you should definitely have one parameter. So it's already, see, it's like we can go and we can just trust the doctor and just come and sit back and see like what is the result is coming, what is not. But if we want to actually compare on our own basis, if we want to have one parameter for that, we should have the record of the child, that where was the child standing before the therapy. So videos are the best ways. Whatever activity, any sitting activity or any physical activity, whatever you are doing with the child, just try to make short videos of it, and just to keep it as a parameter that this was the child's level before the therapy. Okay, so next point is that what should we expect after the therapy. I mean, generally what will happen, that we will be thinking, few parents will be thinking that okay, after stem cell therapy is going to cure autism, stem cell therapy is going to cure ADHD or cerebral palsy, everything will happen. It will happen, but having that mindset that it is going to cure 100% without any other efforts is it's not acceptable. We have stem cell is like the brain is developing, and new nerve cells are being formed, repair work, maintenance work, everything is happening in the brain. So but if you're not giving any input to the brain, I mean the occupational therapies and the speech therapies and those things you are not giving to the brain, that is like an input to the brain, you are not doing that, then the effect will be very less. Even if you go in any center for stem cell therapy, they will be telling you that the occupational therapy and the other therapies, physiotherapy, speech, are very important to be taken after the stem cell therapy, because that is how the brain will be developing in the right direction. Okay. So first and foremost thing that which you will be expecting is like that you will you will not see any instant change in the child. It's not going to like in one day or everything will start changing. You can see minor changes here and there, but it more or less depends on your own effort, like how much effort you are taking with the child, how much therapies you are doing, and how much systematically you are following the home program and everything. Okay, that will have a major impact on it. Okay, next thing is that you have to focus more and more on the receptive part of the child. I mean, just after the stem cell, the brain is developing, but if that input is not going, if you are not telling the brain, if you are, I mean, simply the brain is lying idle, so that will not have that much impact. But if you are like telling the child lot of things, you are focusing on receptive as well, so that will like the child's learning speed will increase. Okay, so this thing you have to keep in mind that just after stem cell therapy you have to give all the work, or you have to do like give maximum support to the child. Okay. And within 3 months to 6 months, as doctors will be telling, that there will be like the changes, whatever you'll see, you will be seeing it in the child. Next point is like the environment at home has to be very positive. If there is a lot of negativity going on around, like the parents are fighting, or a lot of relatives are coming, and there is a lot of hustle and bustle, so that will I mean hinder the growth of the brain as well. Because see, if the mind is pleasant, the mind is calm, the we will also be able to work in a good manner, right? It will happen with us also. Same thing applies on the children also. Just after the stem cell, when the brain is developing and the brain is like getting new nerve cell and everything, and if at that time if you are giving a negative environment at home, definitely it will have a very bad impact on the child. So best way is to keep it positive. Even if anything is happening, anything is going around, just be positive, because as a parent this is your duty. It's not like just you go and spend that much money on the stem cell, and in the home you are like budget 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 budget, and everything, like all the negativities are coming, parents are fighting, and then grandparents are criticizing. That will have even a bad impact on the child. Maybe the stem cell will not even work also. So just try to keep it as like positive 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 all the time. And doctors will also be saying this, that when there is good environment at home, good therapy is going on, and the stem cell, the growth will be immense, and the development whatever we'll be seeing in the child will be very much good. Okay, let me also tell you about the instant impact on the child. Like just after the stem cell therapy, there are a few things which we notice, that generally the kids will be becoming very hyper for 1 2 days, because suddenly there is a spark in the brain, so they become very hyper. And after that while they will be feeling tired also. I mean, they will be like sometimes, like mentally, if we are very much occupied, we'll be start feeling very much exhausted, no? So that side of thing happens with the children. And physically also there may be some pain or something because of the needles and all. First few days, I mean first week you can say. So that all things will be there. So that also will have to be taking care of the child. Okay. Now let's talk about the side effects of the stem cells. See, doctors will be saying that there are like no major side effects of stem cell, because especially if it is from the same body, it is called autonomous or something like that. So there is no major impact, because it is from your body and going into your own body. So the side effects are not there, but there are few things which we have to take care of. Like just after the procedure, there is a chance of the child getting a spinal headache, I mean a headache. So for that we have to keep the child very much hydrated, and we have to be very much conscious about that. If the child is like feeling dizzy or something like that, we have to make the doctors aware and get it treated as soon as possible. Next thing is like if the child is having seizure fits or any that kind of history, these cases may increase. So for that the doctors will be giving that medication, that we need to give it regularly to the kid to avoid anything. In any case, scissors and fits are not good, because that will be like a complete stop on the brain, and then again the brain has to come back. It's like they will be having a lot of negative impact on the brain. So we will have to take care that minimum cases of that is occurring, and if it is occurring, then we will have to supposed to tell the doctor as soon as possible, and then take the medication properly. Okay. I think this video is getting very long. I'll post another video containing the same topic, in which I'm going to talk about the about like when you should be choosing this particular therapy for your child, and what are the options available in India. And I'll be talking more about the centers we have in India. Okay, and how much is the cost and all. Okay, in the next video I will be taking it up. Okay, thank you so much. Bye, see you in the next video.